Okay. So, what is it? What's going on? It looks like we're live.
Yeah.
Have you been getting a lot
Well,
of calls?
these days I'm getting a lot of questions about winter and feeling down, feeling blue. Have you also been getting
Absolutely.
that too? Yeah.
Absolutely. Winter
Okay.
blues, a lot of people are feeling down and wondering what it is. Can't understand
Right.
why. Is it the
For
holidays?
sure.
Is it stress? Is it
Is it
change?
normal? Yeah. And I think a lot of things are kind of this time of year financially, things are, just for those celebrating, they're thinking about their finances, things like that, but also the weather for a big part of the country.
A change
It's,
in season.
I'm lucky out here in California, but even here in California, it's foggy and we do get some rain and that, but like out by you, East Coast, it's cold, and the
It's
days
cold
are
and we have
short.
shorter days now.
Yeah.
Well, it's getting shorter and shorter as we go. So we're
Yeah,
in the deep of it. A lot of things are changing. It's transition, a lot of changes. Yep, I'm getting a
for
lot of
sure.
calls like that. So let's talk
Yeah.
about what that means because people are wondering
For sure.
what
Yeah.
is it? And
Maybe we'll take two of the questions and we'll try to tackle them as best we can.
all right. So let's quickly tell people who we are. I'm Dr.
Yeah.
Valerie Akinrambi, adult
Yeah.
psychiatrist in New Jersey, and you are?
I'm Dr. Al Daher and I'm in California in outpatient practice.
Awesome. And the question is this.
Yeah.
The doc, every year heading into the holidays, I start to feel down. This feeling of dread I cannot shake. It doesn't happen any other time of the year, and I'm having trouble reading it apart from holiday-related stress. But I can't help but wonder if it's related to the weather or time change. It's been going on for maybe 8 to 9 years. I'm a middle-aged mom with 2 high schoolers. The only time I felt like it was actually okay the only time I felt like it was actually okay was oddly the pandemic because we
Oh,
were actually unable to travel due to the shutdown. And I remember that was the least stressed and down I felt. It's important to mention that the holidays bring on stress because of financial strain and a lot of issues with both sides of the family we are obligated to visit.
mm-hmm.
So,
Mm-hmm.
what is this? How do I deal with it?
Yeah. It's so interesting, right? Pandemic, where we think of like pandemic as stressful time. And it was a stressful time. It was a really fraught time, but it
Mhm.
is, I'm always thinking when I'm hearing things, it's like, you know, like an investigator and like looking at variables and factors and which of those are consistent and which,
Mhm.
because that often kind of like leads us to more questions. I mean, the first step in what we do is understanding the problem and
Absolutely.
looking for patterns and looking for connections.
Right.
So, um, this one does really make me think like maybe there is a variable situation here because, but you never know until you try to keep all the other variables the same and then change one thing. So, well, maybe we can just talk about like just break it down. Just what is seasonal affective disorder? Because and then we can like kind of go back and give some advice to this listener.
Of course. Yeah, and speaking of variables, before we get right into that, though, right? The holiday season, that's like a variable that, as the year goes by, there's one variable is the added stress of this period. But for this person, it sounds like they, like Clockwork mentioned, that they get it every year. So it also makes me wonder if,
Mhm.
this is, I mean, it follows a pattern of seasonal. So
Yeah,
what is seasonal affective disorder?
yeah.
It is a type of depression. It's essentially a type of depression that's linked to seasonal changes, most commonly starting in fall and winter. And the main trigger again is the change in season. I always like to emphasize like that's a common denominator
Mhm.
for seasonal affective disorder. And a question that pops up right after then is how do you differentiate that from winter blues? Because some level of winter blues happen. That's common. So how's that different from seasonal affective disorder? And the main difference is that seasonal affective disorder is actually like a major depressive episode that's triggered by a change in season, whereas
Mhm.
winter blues, is characterized by maybe a little low energy, low mood. It's pretty mild.
Mhm.
Doesn't really last for too long.
Exactly. And I think that an important thing that is always kind of like the determinant for when something goes from what people call normal or to be expected for that context
Mm-hmm.
to pathology, disease, problem we need to address with some interventions is, I think the big thing is change in function or impact on function. So that could be function with your job, in your relationships, in your personal life, function in your ability to take care of yourself. Winter blues might be, I like, just as an example, I stay in and watch a movie more often on the weekend nights than in the summer and spring. But seasonal affective disorder or depression is like, now I'm not showering for a whole week, or I'm not, I'm calling out of work more, and I'm just kind of, things are just a mess. Like, I'm not keeping up with bills. I'm ordering out so much that things like that, where then it starts to impact function. So when it impacts function, that's where we're sort of like, oh, okay, we're in a different territory. We really got to take charge here. Let's have some interventions. But yeah, like, because everything's like mild, moderate, severe, winter blues, a little lull. Yes, that is to be. But I think that's an important distinction.
Absolutely. The impairment in function is when we say, okay, we absolutely have to do something.
Mm-hmm.
So one of the things that we do once we say, hey, this looks like seasonal affective disorder, what do we do? And I like to approach this from a non-pharmacologic versus pharmacologic approach.
Mm-hmm.
I think it's a
Mm-hmm.
clear way to talk about this. And I'm wondering, should we even talk about what to do first, or should we talk about the factors that contribute to that? I think maybe
I
let's
think the
touch on that a
factors,
little
because
bit.
it makes sense, because the interventions kind of follow with like, what is the problem, and then
Mhm.
how do we then address it. But so, yeah, so maybe we can touch on like why we think this happens, just like the mechanism of why
Okay,
we think this is happening.
sure. So, I mean, there are three major contributors, or four, about three or four, when we look at seasonal affective disorder. What we know is that the reduction in daylight, the change in that, daylight amounts affects
Mm-hmm.
our circadian rhythm.
Yeah.
And that's like, I think the primary, contributor is that it affects our circadian rhythm.
Yeah.
And I read this very good example of saying, think about your body as a solar powered clock. And so
Oh,
then
yeah.
suddenly you get
Yeah.
less light.
Yeah.
And now
Yeah.
your body becomes confused on what to do. So that's
Sure.
kind of what's happening with the seasonal change. It's like less light, the
Yeah.
timing is off. We
Mm-hmm.
even have this time change. And so, it affects your circadian rhythm, and then that affects your serotonin functioning pathways, which we know is
Yes.
heavily connected with mood.
They're connected. Yeah.
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 And
All of
and
these like
then
systems are connected. Yeah.
exactly. So we affect these serotonin pathways because of that, change in circadian rhythm, and we also affect like melatonin. You want to talk a little more about melatonin, or you want me to take that?
Well, I'd say like there's been very interesting research to show too that like in places of the world where they just get much fewer hours of daylight,
Mm-hmm.
and then sometimes of year where they're getting like, so they've correlated these things with incidences, higher or lower incidences of depression. So this is like documented, it's been studied. There's definite evidence base for this. Like, we do know that like, in sunnier parts of the world or areas where like you're getting more daylight, there's less incident. And it goes down to like blue light and the synchronicity of like our brains and that with like the natural rhythms. And that then goes into light therapy, which we'll touch on as a treatment, so it is all like kind of, it's all connected. But yeah, the less light we get, the more sleepy we are. And in like a simplistic way, like the more likelihood for depression in this sense. So yeah, and then that of course links with the melatonin, which we talked about. You could go to our previous episode on the time change, right, where we talk at more length about melatonin.
Right.
But we think that system is at play as well, and that melatonin, it's when it's darker, there's more natural melatonin production. Melatonin makes us feel sleepy and want to sleep. And so there's that like tendency to like want to hibernate in the winter, and so.
Yep. Okay. Yeah. So, I mean, so those are some of the systems that are involved. And I think there's may or may not be a role for vitamin D here as well. We know with less sunlight exposure means less vitamin D. So, may or may not play a role, but essentially, again, comes back to the disruption of circadian rhythm and, creating a misalignment. And here we are having these symptoms. So what do we do about it? What are some interventions? And I start to talk about non-medication interventions versus medication interventions. So starting with the medication, non-medication intervention, the recommendation is for bright light therapy. It's the most effective non-medication option and first line for many people. Essentially, it's a 10,000 treatment of 10,000 lux of a bright light box. Is the most effective non-medication treatment. Used 20 to 30 minutes every morning, immediately after waking, not at night, not midday. Morning is where the circadian system is most sensitive. So we usually tell patients, put it on your bathroom counter while you get ready or on your desk during breakfast. 3 to 5 days of doing this, people start to feel a lift, although it might take, about 1 or 2 weeks to have a full effect. But usually within a couple of days, people start to feel a lift in their mood.
Yeah, because it's mimicking the sun, essentially. Like the blue light is the frequency in which like you're, and so you want the thing, because how it works is it's getting absorbed by your eye, more specifically the back of your eye, your retina, which is part of your brain. And so you want to make sure you position it like, let's say, it kind of looks like an iPad. They make them now varying
compact. Yeah,
like it looks like an iPad. It's like this size. You put it in front of you. You make sure it's facing your eye. It's not like behind you or something. And then it's no further than like an arm length away. So really, like, you put it where your desktop is while you're answering your email, or like you said, like while you're getting ready in the morning, but you make sure it's facing your eyes. And then 10,000 lux. There's a great, because people say, well, where do I get this thing? And that there's so many now. There's so many manufacturers. We're not sponsored by any, but there's a great, I just sent this to a patient last week. Wirecutter, New York Times. They are supposed to be an unbiased source to kind of like compare different types, different price range. And that's a great way to just look for your budget. You want something under $100, you can find a light lamp for under. You want something a little bit more, fancy, then you can. And a lot of them you can recharge them, and they're portable, things like that. So Wirecutter, light lamp, you can look up lots of different options that fit your budget.
Great. So second item that is non-medication option to treat seasonal affective disorder would be CBT, which is cognitive behavioral therapy that's specific for SAD. It's a CBT that's specially adapted for seasonality. It includes behavioral activation, restructuring negative seasonal beliefs, planning activities during daylight, again, with the goal to maximize activity, resist hibernation, exposure to light during the daytime. And studies show that CBT-SAD, which is the acronym, not only treats symptoms, but it can help prevent recurrence in the following year, which I think is super important.
Yeah. Right. And I think that's important because we know that our emotions are very linked to our thoughts and are very linked to the behavior, like the triad that CBT works on. And I think that like the thing that is the most accessible, rather than just, well, feel better, or just, get over it or have another thought, like the thing, the out of that whole tripod that's the most accessible is behavior. So it's like, okay, if I know I'm prone to this every year, then I'm going to really make a point to get back in touch with my therapist and get that going. Every morning or every midday, I'm going to make more of an effort to go outside if it's possible. I'm going to do the light lamp. Like, I'm going to focus on the behaviors, the things I know that will then kind of set off the positive domino effect with leading to an improved mood, leading to improved, more positive thinking.
Thoughts.
So that's more that's more within your reach. That's something you have power over, is your behavior. I'm just going to focus on putting my shoes on and getting out. I'm not going to focus on if I feel like I want to get out, or if my depression is telling me I should stay. I'm just going to focus on putting my shoes on and then taking that first step out the door. So that CBT is evidence-based. It's, approved. It's been proven time and time again to always work better with any other intervention you're doing, like light therapy or even medication. If you're going to touch on that next, to get asked that too, like, is this something that I should consider being on medication?
Okay. So going on to the medication options. Do medications work for this? Yes, they do work. Remember, again, ultimately, it's still, we think of it as SADs. It's a major depressive episode. The unique thing about it is it's triggered by season. So medications do work. And I'm gonna talk about medicines, from two perspectives. How do we treat like an acute winter episode? SSRIs are often what is recommended and found to be evidence-based for treating an episode that's already ongoing. However, for someone who gets this yearly, who knows, this is something that happens to them every year, we might even be able to prevent recurrence by using a medicine like bupropion when started earlier in the fall before it happens. So thinking about recurrence, and those would be the two places where we start if we're considering medication treatment.
Yeah.
Okay.
Yeah.
Let me see. There are a couple other things that are evidence supported that are not cures, but can be helpful add-ons. I think we talked a little bit about vitamin D, making sure everyone becomes deficient as it gets dark and cold. So you might want to make sure if you walk outside can help you improve increase sunlight exposure, but also increase vitamin D. But also you can have vitamin D supplementation to be helpful.
Yeah.
We're going to talk about exercise for all of its benefits, cardiovascular included, as well as mental health. Capping your naps, right? Because we know that naps, especially for adults, can really then ruin your sleep schedule, your sleep hunger, and mess further with your rhythm. So making sure that you're not napping, especially in the daytime. And in terms of behavioral activation, we've talked about exercise, we've talked about also planning social activities in advance. Having things set up to go. And we like to think of them as SAD insurance for winter.
Yes, exactly. Yeah, exactly. Yeah, because those are working on BDNF, brain-derived neurotropic factor, which are is really good for the brain to make new connections. And when you get into a depressive, spiral, your brain just kind of lives there. But if you're doing these other things like going outside and exercising and interacting with people and doing therapy, that helps the brain kind of make these other more positive connections and get out of that doom spiral. Yeah. So
thank you for that. And I feel like we forgot to mention, because you're in California, and if people are watching in California or sunny areas, and you're like, what is that? It's not something that's prevalent significantly in sunny environment. So the places where SAD is common would be, northern places, northeast USA, Minnesota, Maine, and so on, where we have really significant changes in daylight and daytime would be where we have the higher prevalence of SAD. Any other thoughts? Any other questions? I don't know. Did we? Do we have enough time for another? I think we can.
I think we might be kind of because there's a lot of questions about this, and we want to maybe even touch on just depression, and maybe we'll do the next, stay tuned for our next episode where we can cover the next question we got, because that really touches on just depression. Is it depression? Is it not? And we could just open up the conversation just about depression in general.
Okay. Sounds good. All
All
right.
right.
I guess we'll wrap things up today then. It's been a
Okay.
pleasure chatting with you. Thank you for
Yes,
joining me
as
from
always.
California.
As always, get outside, bundle up, get outside,
I will
get your
stay there.
rest.
Thank you
Yeah,
very
and
much.
be kind to yourselves.
Absolutely.
All right. Till next time.
All right. See you catch up next week now. Bye-bye.
Okay. Bye-bye.
Bye.